Good morning, Ma'am. This is NCM 114, Care for Adults. What is home care and hospice? Home care are short-term medical service ordered by a doctor and provided at home to help adults and seniors recover or rehabilitate from an injury, illness, surgery, or hospitalization, or to help them learn how to better manage a chronic condition such as diabetes or COPD. So a home care it is done outside the hospital that ordered by a doctor or panandaliang paggamutan or paggagamot sa loob ng bahay or sa labas ng hospital. Hospice care provide clinical, social, emotional, and spiritual care and support for a patient and their immediate family members near the end of life. As part of hospice, the care team provides palliative care designed to keep the patient as comfortable as possible with a variety of interventions to reduce and manage pain and other symptoms. They also provide respite care, which means patient care that allows family caregivers the opportunity to rest, rejuvenate, and leave the house to do other things either on a planned or emergency basis. Hospice also include bereavement care or grieving care for family members following the loss of the loved one. To qualify, a patient must decide in collaboration with their doctor and family to discontinue curative treatment for their terminal illness, and the doctor must certify a life expectancy of 6 months or less when curative treatment ends. Hospice care steps in. So, a hospice care it is the time when the doctor will tell the patient that you will only have 6 months or less to live. That's when the time hospice care steps in. So, this is the compare of hospice and home health care or a Medicare-funded home services. Hospice care, it is a comfort to care to manage symptoms, prognosis 6 months or less, provided wherever patient calls home, patient is free to leave home, skilled and personal care, meds supplies provided, and visits scheduled as needed up to 24 hours a day when medically necessary. While the home health care, it is a treatment or therapy to restore independence, condition must show improvement, providing patients private residence, patient must be homebound, skilled care provided, no meds, supplies, personal care, and visits up to 8 hours a day for 21 days. Hospice and home health care is to avoid and reduce hospitalization. Care ends if patient is hospitalized, allows patient to remain at home, physical and psychosocial care, and unlimited recertification. So that is the compare of hospice and home health. What is community-based service? Community-based refers to a philosophical approach in which communities have an active role in participate in highlighting and addressing the issue that matter to them. Community-based means being in the community that you serve geographically and philosophically. A community-based approach invites communities to actively design, develop, and deliver their own fast prevention and intervention strategies. Community-based service, a generic term for service provide outside of a hospital setting, usually in clinics or surgeries, which are provided to support an individual living in her own home or to support her career. So community-based, as what it says, community, it is done outside the hospital to provide the needs of the people in the community. So what is living assisted? Or what is assisted living? Assisted living is a type of housing designed for people who need various levels of medical and personal care. Living spaces can be individual rooms, apartments, or shared quarters. The facilities generally provide a home-like setting and are physically designed to promote the residents' independence. Services are offered to assist residents with daily living. So assisted living ito yung uri ng housing design para sa mga tao na nangangailangan ng medical and personal care. Then, this is the service offered by assisted living communities, vary from facility to facility. Service often include 1 to 3 meals a day, monitoring of medication, personal care including dressing and bathing, housekeeping and laundry, 24-hour emergency care, some medical services, and social and recreational activities. So, special care unit. A special care unit or the SCU is an inpatient unit within a healthcare facilities that is custom designed, staffed, and equipped to care for people with specific health conditions. They are usually in a physically separate space from other patients' room. It is the unit that's physically separate from the regular intensive care unit. Nurses' care management is the care delivery system, with medical care delivered by one attending pulmonologist. Patients are transferred to the SCU following a 5-day stay in the ICU and remain in the SCU until discharge. It acknowledges that aggressive use of sophisticated technologies is not sufficient to restore an acceptable quality of health to patients who have experienced prolonged periods of critical illness. Instead, it is important to alter the environment to provide a more balanced approach, tending to social and emotional needs and explicitly re-evaluate goals of care. Geriatric unit. Geriatric unit, it is a unit that specializes, focused on healthcare of elderly people. It aims to promote health by preventing and treating diseases and disabilities in older adults. There is no set of age of a geriatrician or geriatric physician, a physician who specializes in the care of elderly people. Rather, this decision is determined by the individual patient's need and the availability of specialists. So, a geriatric unit, it is the unit that nagfo-focus or nag-specialize sa mga health ng mga may edad or mga matatandang tao. Ang goal nito is to promote or to protect the health and to prevent or para maiwasan ang mga malulubhang sakit sa mga matatanda. So, that is the geriatric unit. So, thank you and God bless. That's all.